Bismillahirrahmanirrahim. The topic of our discussion today is acute liver failure. Acute liver failure is an acute liver illness which occurs as a result of damage to the hepatocytes of the liver resulting in massive necrosis. So as a result, almost 80 to 90% of liver functions are lost and result in acute liver failure. So acute liver failure is associated with encephalopathy and coagulopathy, which occurs within 26 weeks of initial liver injury, and there should be no history of previous liver disease. So acute liver failure is defined as an acute liver illness associated with encephalopathy and coagulopathy. The disease must occur within 26 weeks of initial liver injury, and there should be no history of pre-existing liver disease. So these are the causes of liver failure, which include infection with the hepatitis viruses. Moreover, autoimmune hepatitis also results in continuous damage to hepatocytes. Certain drugs such as acetaminophen constitutes almost 50% of cases of acute liver failure. Certain metabolic diseases such as Wilson disease, which is associated with increased deposition of copper inside the body, also results in acute liver failure. Last but not least, alcoholic and non-alcoholic fatty liver diseases also result in liver failure. Coming on towards the pathogenesis, so it all begins with an insult or injury to the hepatocytes by any of the factors we discussed earlier. So damage to the hepatocytes result in the release of reactive oxygen species and puts the cells in oxidative stress. Oxidative stress means increase in number of reactive oxygen species, which include hydroxyl ion, superoxide ion, and hydrogen peroxide. So reactive oxygen species damage the organelles in the cells such as endoplasmic reticulum, which results in the activation of caspases, which result in apoptosis of hepatocytes. Moreover, damage to the mitochondria results in hepatocytes necrosis. So the massive cell death in the liver also releases some inflammatory mediators, which recruit leukocytes to the site of inflammation, resulting in increased hepatocytes death. Acute liver failure becomes prominent when almost 80 to 90% of hepatic functions get compromised due to excessive cell death. Acute liver failure typically starts with nausea and vomiting. There might also be right hypochondrial pain. The examination reveals jaundice, which is indicated by yellow discoloration of sclera, mucosal membranes, and skin. Moreover, there is increased AST and ALT levels in the beginning, and the liver is enlarged due to swelling of the hepatocytes, edema, and infiltration of leukocytes. Right after the early phase, liver typically starts to shrink and ALT and AST levels decrease. The decrease in ALT and AST levels is not an indicator of improvement. The ALT and AST levels are decreasing because of excessive cell death. The worsening condition is typically characterized by increasing jaundice and increase in serum bilirubin level. Normally, bilirubin level is 0.2 to 1 milligram per deciliter. Moreover, coagulopathy, which is bleeding disorders, and encephalopathy might also start to appear in acute liver failure setting. The clinical manifestations of acute liver failure include jaundice, hepatic encephalopathy, coagulopathy, portal hypertension, and hepato-renal syndrome. Since there is damage to the hepatocytes, there is a decreased uptake of bilirubin by the hepatocytes and there is impaired conjugation. So as a result, bilirubin is retained in the blood and its levels start to rise, resulting in jaundice. Excessive bilirubin deposits in the sclera, mucous membranes such as below the tongue, and in the skin, resulting in itching of the skin. The normal level of serum bilirubin is 0.2 to 1 milligram per deciliter. Excessive bilirubin is also excreted in urine, resulting in bilirubinuria. Jaundice also predisposes a person to severe bacterial infections. Coagulopathy means bleeding disorder. Since there is damage to the hepatocytes, there is loss of synthetic functions of liver as well. Since both vitamin K dependent and non-dependent clotting factors are produced in the liver, the dysfunctional hepatocytes fail to produce clotting factors, resulting in bleeding disorders. Bleeding disorders typically appear with small bruises, and they can progress to more fatal complications such as intracranial bleeding. Moreover, these clotting factors are also cleared from the blood by liver, and in certain cases there is excessive accumulation of clotting factors in the blood, resulting in disseminated intravascular coagulation. Coming on towards the encephalopathy, which is characterized by the confusion and stupor at first, which later on progresses into loss of consciousness and deep coma, which can also lead to death. One typical sign of hepatic encephalopathy is hysterexis. Hysterexis can be demonstrated in a patient with hepatic encephalopathy. The arm of the patient is fully extended, as you can see here, and the wrist is dorsiflexed. Upon dorsiflexion, the hand starts to move back and forth, resulting in flapping tremors, which is known as hysterexis. So in a normal liver, ammonia produced as a result of protein catabolism is taken up by the liver and it is converted into urea, which is excreted in the urine. But in case of acute liver failure, there is impaired ammonia elimination from the body. So increased level of ammonia in the blood enter the brain and cause some degenerative changes, which result in defective neurotransmission. Portal hypertension is more commonly seen in chronic liver failure, whereas it is rarely present in acute liver failure. In acute liver failure, due to edema and swelling of the liver, there is an excessive resistance to the flow of blood, which results in pooling of blood in hepatic portal veins, which results in leaking of fluid from veins into third spaces such as peritoneum, resulting in ascites. Hepatorenal syndrome means a damage to liver resulting in a compromised renal function. So in acute liver failure, excessive inflammatory mediators are released into the blood, causing systemic vasodilation, causing pooling of blood in systemic blood vessels. So as a result, there is poor perfusion to organs such as kidneys due to minimal blood flow. So decreased blood flow to the kidneys result in activation of renal sympathetic nervous system, which results in vasoconstriction of afferent arterioles. There is increased renin and angiotensin secretion. So increased renin and angiotensin secretion results in salt and water retention, resulting in decreased urinary output and increased blood urea nitrogen levels. Moreover, there is decreased clearance of creatinine from the blood, resulting in increased creatinine levels in the blood. So this concludes our section about acute liver failure. If you have any questions, do let us know in the comment section. Thank you.